living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Happy New Year! We've completed another orbit around the sun, and that means closing the books on 2018 and getting ready for 2019. But before we do, we want to take a few minutes to look back at the past year and the topics we've covered on Healthy Living for Life in our mission to help you do just that. Today, all our hosts are here to talk about some of our favorite shows and topics, and hopefully some of your favorites too. We'll start our 2018 Healthy Living for Life year in review right after this. Stay tuned. Welcome back. Joining us first this morning for our Healthy Living for Life year in review, our fellow hosts Sarah Medley and Janet Whitmire. Ladies, thanks for being here and Happy New Year.
Happy New Year.
Happy New Year.
So Sarah, let's start with you. Looking back on the past year, what stands out to you as a great topic?
We've had great guests, great shows, but our own Mountain Pacific pharmacy staff stand out to me. Drug costs, drug medication errors, critical topics.
Perfect. It is a critical topic. Let's take a look.
The more you know about your medications and the more you talk to your healthcare providers, the more educated you will be.
Yes.
And the safer you will be with your adverse drug events. So like I've always said, be very proactive. And then lastly, an interesting tidbit is that as we age, we process medications differently. Yes. And so medications that you normally wouldn't have a side effect to, you may find that you're now suddenly having side effects to them. So if suddenly some new symptoms appear, you might want to talk to your doctor about if they could be related to the medications you've been taking.
If you're using one pharmacy, which we highly recommend, they're going to have that complete list and share with them your over-the-counter medications. So I think that's really imperative. The other thing you can do is you can take all of your medicines in a bag to your doctor's office when you have a visit so that they're able to reconcile with the medicines that are on their list that they have on record there as well. And I think also another key point is that if you're in a hospital situation or a nursing home and you're transitioning, to ask questions. Make sure you understand, and it's important also, I remind people, take notes. If you don't have something that's printed out for you, even if you do, it oftentimes is very helpful to jot down notes to help you keep things straight. So make sure to do that.
Keep a list of all of your current medications, you know, the over-the-counters, the natural supplements, vitamins, you name it. Put it on your list and carry that list with you. Keep it in your wallet or in your purse so that you have it. You take it to your appointments, take it to your pharmacy if you need it. And also make sure that someone you know knows about this list and knows where you keep it in case you have a medical emergency and can't speak. They can just pull it out and say these are what that person is taking. Another way to reduce risks is just be an advocate for yourself. Yeah. Ask questions. You know, when you get a new medication prescribed, ask why. Ask what could be some of the side effects. Should I take this with food or should I not take it with food? You really want to look into all of those types of things.
Coupons can be a little misleading or a little deceiving at times because they might cover you or lower your copay, or in some instances have no copay for a limited period of time. But after that time period is up, you may be forced with the full price of that medication that's now no longer covered by your formulary. Mm-hmm. So it's really important to ask your pharmacist about how that coupon works and what the ramifications are and the time limits that might be associated with it.
If you fill your prescription, you're there at the pharmacy, and you realize it's going to cost hundreds of dollars, right at that point in time, have the conversation with your pharmacist and ask them if there's something that might be less expensive that would work for you. The other part of that is to make sure that you don't pay for your prescription and leave the pharmacy if you have a concern about cost, because once you leave the pharmacy, you're going to be stuck with it.
That there are a lot of medications that are now on the market. Every year, more and more get released to the market. And last year, they had almost like it was like a 21-year high record. They had 46 new novel medications released, which was double from the year prior. So just with more people, more drugs available, it just sets us up for more adverse drug events.
Make sure that you have a routine in which you're remembering to take your medicines. If you need to set an alarm, if you need to work that around a specific time of day, you take a walk, you have dinner at a certain time, that's important. If you need to, you can certainly get a pill organizer. These are available in all kinds of different sizes, shapes. They can hold lots of different pills. They can be used for once time a day. If you're taking things up multiple times a day, there's multiple compartments for those, so that's really important. It's important to keep a medication list, keep an up-to-date list of all your medicines, what they are, what they're used for, how often you take them. All those kinds of things. You can make a list on your computer. Some folks are very into that, and so that's easy to do. Keep the printed copy of the list with you. Make sure you take it to all of your doctor's appointments. That's extremely important. And regardless of your system, just make sure you're consistent and you do that stay up with that, because it's important to take things as they're prescribed and make sure you do that routinely.
We really have done a lot on medications and medication safety, but it is an important topic, so thank you, Sarah, for that. Janet, how about you? What's one of your favorites?
Well, I think healthcare costs and healthcare insurance are a real concern for folks after, especially retirement. So I like to focus on revisiting what we did to help people with that information.
Great idea. Let's see what we have.
In the old days, we used to actually, when somebody looked at retiring, they most likely had their home paid off and their costs were reduced. Well, with healthcare, that's not necessarily the case anymore. And the medical inflation rate is averaged over the next 10 years to be about 6%. So it's important when we start looking at that long-term planning process that we try to incorporate that while we do it. So right now, a couple would probably look at about $750 a month in terms of their Medicare B, D, and supplemental premiums, which is about $9,000 a year. Then if we start looking at adding dental, that's about $11,000. And then if we start looking at glasses, because usually people have glasses for reading at some point, now that number looks closer to about $12,000 a year.
Under age 65 and they're thinking of retiring, there's many different things they should be looking at. Do they have COBRA eligible to them? What is the cost? Have they already met their maximum out-of-pockets and deductibles? Or is it better for them to maybe look at an individual policy? They can either go direct to the company or they can look through the healthcare.gov and the federal marketplace.
So what we usually do is we talk about what is your current health situation. Obviously, if somebody has a health condition right now, I have a couple that have some pretty significant health issues out there, and planning for how that will progress. You have a general idea, but still it's that crystal ball that we don't really have to say what an individual's health care is going to look like going forward. So usually what we do is we look at current numbers and we say, a compliant patient who is following doctor's orders is probably going to have better outcomes than somebody who doesn't. Sure. And just try to work as best as we can with what we have with current knowledge.
Thank you so much for letting me talk about SHIP, because they are the most wonderful advocates that you could find. They're a statewide network of counselors who are extensively trained in Medicare, and the SHIP piece of it stands for State Health Insurance Assistance Program. There's one in every state in the territory, so we are a national program, and they are delivering no-cost, objective information to the beneficiary, or the beneficiary and their family, or just the family. Whoever needs that information can come to the table.
There are several different plans available for long-term care. The most common type is called an expense plan, or expense policy, and what it's designed to do is cover whatever that daily, monthly, or weekly expense, depending on how the plan is structured. And so it pays out so much per day and covers that expense. Long-term care is one of the most expensive things that people will deal with in their life when it comes to medical care. And so, especially if you've accumulated assets and you want to protect those assets, having something in place to handle that and help with that, like a long-term care policy, is really helpful. And that's really what they're designed to do.
There are still more topics to revisit from 2018 on this special edition of Healthy Living for Life. Stay with us. Welcome back. Janet Whitmore is still here, but joining us now is host and expert guest Lisa Sather. Lisa, thanks so much for joining us. Happy New Year to you.
Thank you, Beth. Same to you.
So I know you're passionate about medication and medication safety, but what else have we talked about in the past year that really stands out to you?
Yeah, I think heart disease is a big one because it is a leading cause of death in the United States. So I think we should revisit that.
Perfect. Let's do that right now.
So a heart attack is when there's an interruption of the blood supply to the heart muscle. The heart muscle at that point will start to die. People can have heart attacks and not even know it. So they will lose a small portion of their heart muscle and actually survive and go on to do other things. Sometimes, however, when a portion of the heart muscle dies, it again causes the electrical instability, which causes the heart to fibrillate and stop, which is called a cardiac arrest. So the heart can fibrillate and stop due to electrical problems and not due to a loss of blood supply, a heart attack. Mm-hmm. So you can have a cardiac arrest without a heart attack, and you can have a heart attack without a cardiac arrest, but sometimes the two go together. One is electrical, the cardiac arrest, and one is more of a plumbing issue, the heart attack.
Women are more likely to have a stroke, and some of that correlation is with age. Women tend to live longer than men, so we have a higher incidence of stroke. But the risk factors for heart attack or stroke are really the same for men and women. And I think it's important, Doug had said, about calling 911, but the other thing for prevention in regards to stroke or heart attack is seeing your primary care provider on a regular basis so you can identify risk factors, whether you're a woman or a man, and treat risk factors to prevent a stroke or heart attack from happening. So whether that be if you're diabetic or have high cholesterol, overweight, things like that, I think prevention is key to prevent people from ending up in the ER.
Okay.
So.
Stress management is huge. I mean, there's a lot of studies that show those type A people are more prone to cardiovascular disease. So techniques, they're doing a lot of studies with meditation to improve cardiovascular outcomes, yoga, exercise, laughter, taking a hot bath, just if you have a situation in your life that's causing you stress, find ways to mitigate it.
Well, one of the things that I think is the most important for everyone is to listen to your body, to really listen to it. Like, what does it need? Does it need exercise? Does it need healthy food? How is your weight? I cannot stress enough that most of the reduction that we see in heart disease is due to the prevention and the main risk factors, which is don't smoke, maintain your ideal body weight, exercise regularly. We recommend 150 minutes of aerobic exercise each week. Eat lots of vegetables and fruits. Try to limit your carbohydrates. Those kinds of things really will help people if they're serious about reducing their risk for heart disease.
Doing what we can for heart health is really important, Lisa, so thank you so much for bringing that one up. Janet, how about you? Do you have another topic we should revisit?
Well, I think prevention in general is just really important, and I think there's some steps that we can do to stay healthy, like vaccinations.
You're right. Let's take a look at what we learned about immunizations in the past year.
Approximately 50 to 70,000 adults die each year just from complications related to the flu and pneumonia. And that number could be drastically reduced if everyone would get vaccinated. So that's really important. Based on policies developed by expert groups like the CDC, it is recommended that all healthy adults do get vaccinated. And especially those who have chronic conditions, it's really important because they can really suffer from consequences from getting one of these vaccine preventable illnesses.
By the time we got to 2000, the average life expectancy in the United States was 78.1 years. You have this huge increase, and you think about, well, that's because all these things that happen in medicine. We got antibiotics, we could do better surgeries, we have insulin now that wasn't around beforehand. But actually, when you look at the data and everything, about 25 of those years are due to public health. And the CDC put out this great, CDC is Centers for Disease Control and Prevention, put out this great tribute at the end of last century called the 10 Greatest Public Health Interventions in the last century, and that had the effect on that. And vaccines is one of those. It's a big one in there.
The flu is a very smart virus, and it keeps changing, and so we need to keep adjusting the vaccine to so that it will work each year.
Really, there are folks who are at risk for getting higher complications from the flu, folks that are 65 and older, the very young, and those with specific health conditions like diabetes, heart disease, kidney disease, those kinds of things really are at greater risk, and you want to make sure you get vaccinated.
They will not get the flu from the vaccine. It is an inactivated vaccine, and you cannot get flu from the vaccine. There are some side effects. You can have a sore arm and maybe get a little bit of a fever, but you will not get the flu from the vaccine.
And there was Lisa again as an expert guest. Thank you, Lisa.
Absolutely.
Okay, ladies, last chance. Any other topic you want to do for end of year?
Well, I think that we think of our home as a place of safety, but really there can be risks there.
Yes, I think clutter in the house is an important topic to look at, decluttering to reduce fall risk.
And for our physical as well as mental health.
Good point.
Great, ladies. Let's take a look at what we did on home safety.
So in your bathroom, make sure that you have something to absorb any of the water that comes from your shower or your tub. Make sure that you have handholds, especially getting into a tub shower combination, because that can, when you're on one foot, that can be disastrous. So make sure you have something to brace yourself with. And also in the tub itself, if you get any kind of oil or anything in a bathtub, it becomes an ice rink. So make sure that you have some kind of an adhesive attachment in the tub that will help from slipping as you're taking your shower or your bath.
Well, keep the house as clean as possible. Of course, and they probably know whether or not they want to know or want to think about it. They might be allergic to their animals or not. And so minimizing exposure to the animals that they may have in their house also is useful. Keeping the house as clean as possible. Keeping the animals out of your bedroom. You spend 8 hours a day or more in your bedroom. And so that's 8 hours that you could have as a clean space for you if you can keep the animals out of there if you're allergic to the animals. Okay. Also changing your sheets often, vacuuming frequently, using a HEPA filter, using an air freshener in your house. It helps if you know what you're allergic to as well. So if you've seen an allergist and you've been tested and you know that you're allergic to dust mites but not your dog, then that's useful because you know how to treat that in your house differently than somebody that doesn't know what they're allergic to.
But there are other issues in your home. Keep it well lit. Make sure that you're aware of your surroundings, especially at night. A person, as they age in particular, can become very disoriented. In fact, it happened to my mother. About 5 years ago, my mother became disoriented at home, and she actually fell down about 15 stairs into our basement, which is concrete. She fractured her hip. Luckily, she had a life alert or some kind of a mechanism on that alerted the fire department, and they were able to come over and break down her door and bring her to the hospital for treatment, but it could have been tragic.
Well, you can imagine how stressful it must be, more so for some people than others. And you might have poor eating habits. If your kitchen counters are full of clutter, of course, there's no place to fix food. You might just microwave everything. Mm-hmm. And poor mental health. And of course, my favorite is chaos. Creates chaos. Can't have anyone over syndrome. And this just means you're afraid to open up the front door to anyone. You live in fear that somebody's going to drop by.
You know, I think the biggest thing is if you feel like your stuff is weighing on you, it is very true. If you are overwhelmed by your stuff, that's a true feeling, and it really does a great thing for your health to be able to live in a clean, decluttered environment.
Coming up next, we'll wrap up our special year in review edition of Healthy Living for Life. Stay with us. Welcome back. Joining me now is someone you don't see on camera, but is an important part of Healthy Living for Life, our lead producer, Peg Donahue, and Sarah Medley is also back. So Peg, you're going to start out 2019 by retiring. Congratulations.
Thank you.
But before you go, what's been your favorite part of our show in 2018?
We've had great guests with great information, but for me, it's the personal stories.
That's so true. Let's take a look at some of those personal stories.
I would say that ALS, certainly for our family, as difficult as it was, as I mentioned before, was a wonderful opportunity for us to focus on our family, do those things that we never did before. And also the other thing is we need to find a cure for ALS. And Pam was a strong advocate, even after she was diagnosed with ALS, for getting the proper funding to find a cure for this from Congress. In fact, she traveled in her wheelchair back to Washington, D.C. to lobby Congress for additional funding for research to find a cure for ALS. In my opinion, it's not a matter of if we're going to find a cure for ALS, it's when. And so we really need to put pressure on our federal legislators and others to do that sooner rather than later.
It's just a difficult time in that all you're doing is thinking of hope. You're thinking tomorrow everything's going to be okay, next week everything's going to be okay or something, and you're going to be home and your loved one's going to be with you, and the doctors are going to do everything and they're going to save their life. And then the team came in to talk to us about organ donation, and they did a great job, they really did. And we really appreciate that they opened the topic with us, but it is so hard to hear when you have a loved one in the hospital, particularly a child, because everything that you're thinking at that time is that everything's going to be okay. And when they start talking about organ donation, you have to open your mind to the possibility that things may not be okay, and that, you know, is so hard to hear at the time. Although I'm so glad they did it, because, you know, although Julie passed away, because we were able to get everything done correctly and in timely manner, she was able to help so many other people.
You know, my husband and I will often talk about what's in 10 years or 20 years of retirement, and sometimes my brain will go to the worst case what ifs. Well, what if I can't walk in 20 years? And so we plan, but we also know we may have to adjust. But I think more than anything, we just take each day as the gift that it is and try and live that to the fullest and not worry about all of the what ifs.
We're almost out of time, but Sarah, I'd like to close with you. How would you like to end our 2018 year in review?
Our greatest message, I think, is that one has to take care of their health, be their own healthcare advocate, which includes healthy living.
Perfect. Let's get some advice.
This is such a pertinent topic for this time, and I would stress two reasons, Lisa, to your audience. Number one, a study was just reported out of Johns Hopkins by Dr. McCary in the last year, which indicated that medical errors are the third leading cause of death in the United States behind heart disease and cancer. I mean, think about that. But on the positive side, actually, the value equation, which I will explain briefly, is actually driving healthcare in this last year and a half, not only driving healthcare from the standpoint of quality, but also because of payment. And the value equation says we must do everything to improve quality and safety, patient satisfaction, and that's the numerator, and underneath is we need to stabilize or reduce cost. So that's forcing healthcare to be patient-centric versus hospital-centric or provider-centric. So indeed, the patient has a much more important role than they've had in the past.
So engagement, to me, means it's a two-sided coin. The physician needs to be engaged with the patient in the sense that they need to not only ask about their symptoms, but ask about how they feel about their health care and what their goals are, what their sense of well-being is and what that means to them, and what they're willing to do to achieve that. From the patient's standpoint, it means being an active participant, not just simply listening to what the doctor says, but asking them questions, making sure that you understand what they're talking about, making sure that you understand what the physician is trying to accomplish and that it fits with your goals. And that means asking questions, taking notes, being involved.
So part of being prepared is having a list of your concerns or questions and then prioritize them. So make sure you have the number one concern on the top and start at the top and work your way down. If you have a long list and you know that going in, when you make your appointment, tell the receptionist that you're probably going to need extra time so they can schedule you for extra time. Otherwise, we're going to be trying to get through that whole list and everything's going to be really superficial. Don't be surprised if you have a long list, if you have to make another appointment and come back.
Well, first of all, for every referral from a general practitioner or your primary care, it could be a nurse practitioner, you need to make sure, if they're referring you, that you tell them you want your records sent to that referring physician. Secondly, I would like to remind all your viewers, they own their medical record, so they can have access to it.
Repeat back to the doctor or to the provider what your understanding of what they've said is. And that helps them realize whether or not you understand what's going on and whether or not they need to change their communication. So I think that's important. I think you should always feel free to take notes or to bring someone along with you who might be able to help catch details that you miss. It's important, I think, to ask the provider if there are other sources that you can read later to try and understand what's going on. But I think asking questions, feeling free to take notes, and to rephrase what your understanding of it is very helpful.
That does it for our year in review. Until next time, stay fit, stay well, and stay healthy for life with Healthy Living for Life. And from all of us, Happy New Year!
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.